Welcome to our newest episode of the Lebanese Physicians Podcast. And today I have uh, two medical students with me, William Azar and Nadia, both medical students at Georgetown University in their third year of medical school. And the reason we have them today is to discuss entrepreneurship to help fill the medication shortages in Lebanon, as both William and Nadia spearheaded the project and sent a lot of medications to Lebanon recently successfully. Welcome, Nadia. Welcome, William.
Thank you. Thank you.
First, I'm going to start by having you guys give me a bit of a background on yourselves. So, Nadia, can you start by telling me a bit about how you ended up at Georgetown and some of your background?
Yes, of course. First, thank you so much for having us. William and I were super excited for this. I grew up in Lebanon. I was actually born here in the US, but my parents moved back when I was like 2. And I grew up in Lebanon my whole life. I actually went to school with William. We were both at IC, and we graduated from there in 2016. And I had always known since like a young age that I wanted to go into medicine. So it was always kind of on my radar that I wanted to come to the US and do my training here. So I decided to apply to universities from like high school to come here for undergrad. And I ended up doing my undergrad degree at Cornell in Ithaca, New York. It's like in the middle of nowhere. But it was great. I really enjoyed it. And then I applied to med school in my senior year. And I ended up here at Georgetown with William, which was crazy because we knew each other from IC. So now I'm in my third year here at Georgetown. I haven't fully decided what I want to go into yet, but I'm leaning towards going into a surgical subspecialty. And I've always been, passionate about like global health and public health. I studied that in undergrad and I did a lot of volunteering in that. And I continue to do that in medical school. So this project was kind of a natural extension of my passions.
Nadia, William, can you tell us a bit about your background?
Sure. So as also Nadia mentioned, I grew up in Lebanon. We went to the same school. We graduated from IC in 2016. I graduated from AUB in 2019 with a degree in biology. And then I decided that I really did not want to be an IMG because you know how hard they're making it these days for IMGs. So I decided that I'm going to just try to move to the US. I did a master's at Georgetown in physiology and biophysics. And I got accepted into medical schools in the US. Chose Georgetown. I'm currently a third year with Nadia at Georgetown. And I also think I'm going into a surgical subspecialty. And I think the fact that me and Nadia really have similar backgrounds, we grew up in the same areas, we went to the same school, we are now in the same medical school, it really made us think in the same direction, really made us share some similar goals and interests. And this project that we did together is just a mere example of this.
Yeah, this was a great undertaking, and the fact that it was successful is very big too. So we'll talk about it in a bit. But can you tell us a bit of a background? So Lebanon, there's always been ups and downs in the country, but for the most part, over the past 30 years, everything was available. You could get medications anytime you want to. It wasn't a big issue. Until after the financial crisis and economic collapse. So can you give us a bit of a background about how the medication shortages in Lebanon and how severe that has been over the past couple of years?
I think I was there during the crisis, so I kind of witnessed it in person. When I had this experience at a pharmacy where I actually saw a man crying because he couldn't find one of the drugs he was looking for. So I was able to help him because I had to text some people actually in Washington, D.C. who were able to find a connection and send the medication. So this is just an example of, how difficult it was for people to find even the simplest medications. This was just an anti-reflux drug for his mother who had cancer, but he was really sad because it really bothered his mother. And so it's not that it was a drug shortage for really difficult drugs, such as cancer drugs, chemotherapy, for example. This was definitely a huge problem, but also we had antibiotics, children dying from, the easiest, the most treatable diseases. The drug shortage really was a national tragedy in Lebanon, a big threat to our national security. and it won't really end anytime soon. This never happened in the past, but now with the fluctuations and the monetary crisis, basically, this is projected to last for years at least.
Yeah, and I think what's more concerning is the absence of some of the chemotherapeutic agents to treat uh, malignancies. And
Right.
Nadia, you wanted to add something, right?
Yeah, I was just gonna add that, like, just from talking to people in healthcare back home, even in hospitals, like they had to ration their services and like prioritize certain patients, and then it became who can pay more for certain things, which it shouldn't be that way at all. And I heard of people dying from totally avoidable and very easily treatable things. And one thing that also stood out to me was how there was a shortage in the immunizations for children. So this causes a huge public health crisis on the long term if you don't immunize your children early on when they're supposed to get their immunizations. And on top of all that, there was the COVID pandemic going on. So the healthcare system was super strained already. So it was just like completely collapsing with all of this added pressure.
And Nadia, with your background in global health, I'm going to ask you this question. So, how did you guys come up with the idea to start this project, and why did you think you were going to be successful in doing it?
Good question. I don't think we knew we were going to be at least as successful as we were. We're very thankful for that. But so I'll tell you a bit how I came up with the idea. So I got stuck in the US when COVID happened. I was still in university in my senior year, and I couldn't go back in 2020 because, the airport shut down, whatever, it was really hard. But of course, I was hearing about everything going on back home with the revolution. I was following that. And then, of course, the explosion and the COVID, like how COVID was impacting Lebanon as well. And I was talking to my family and friends, and I knew how bad the situation was. And like I was seeing pictures and all that stuff. But I ended up going back in the summer of 2021 for the first time, like post explosion and post COVID. And it was like a whole new shock and heartbreak that I experienced, like seeing it firsthand. I felt like I went back to a place that was completely different, like my home wasn't there anymore. Just the spirit of people was so different. Walking into stores, like think the shelves were empty, like it was just so shocking and crazy to me. And I during that time, like I was there over the summer, I just had this like very intense feeling of survivor's guilt that they talk about. Like, why do I have it better? Why do I get to go back to the US and have everything available to me in the blink of an eye? And just everything come easy to me, while like my family and friends can't even get like the most basic medications, or can't find fuel, or have to wait in line for 4 hours to get their car fueled, can't go to work. Like it was just crazy, and I just felt like it was so unfair. And it's my home, so I really, really wanted to do something. And when I came back to the US, I was just thinking like I have to do something. I can't just sit and watch this happen. Um, like I feel like I've always had this idea like to use your privilege in a good way, because sometimes it feels unfair when you have so much more privilege than others. And when I came back to the US to start my second year of med school, I was seeing these like Instagram pages of people sending medications, or like citizens in Lebanon posting medications they really need. And some people in like Paris and London and the US being like, oh, I have this medication, I'll send it with my friend who's going. So it was very like a personal, like individual effort. And I thought that was a really good idea. And I was thinking how we can like scale it and make it into a bigger thing. And I knew I wanted to do help in like the healthcare sort of aspect, because that's like the field that I'm studying and what I want to go into. And of course, it's like a very like pressing and demanding and pressing situation when someone's health is at stake. So seeing those Instagram pages and people successfully sending medications, like sparked this idea in my head. And I called William one day. It was like at the second week of our second year of med school. And I was like, we need to do something about this. What do you think of sending medications to Lebanon, like from DC, organizing like an effort? And he loved the idea. He was very like motivated to do it. And he encouraged me actually a lot. And that day I think we were studying or something for like an anatomy exam, I remember. And he was like, there's this group on Facebook of like all the Lebanese people in the DMV area. And I think it had like, I don't know, 1,000 members or something. And he was like, so what do you think? Should we post on there and see, to gauge the interest, to see how people if people would be able to help and support, and if people like this idea, so we can start doing something. And he posted, and like just in a few minutes, he got so many responses, like so many responses. People were very willing to help, and they were like, please let us know how we can help. This is a great idea. So that's how it started. And it really encouraged us to continue thinking and growing the idea. I think he'll tell you more about this in a bit.
So, yeah, William, can you tell us more about this? So it looks like you were roped into this project and you were excited to pursue it. So what prompted you to decide to post in the DMV site on Facebook, and then what happened afterwards too? I mean, this is really the power of social media, I think.
Right, exactly. The power of social media really proved to be central in our campaign. It was really, we just really did not know where to start from. We saw these people sending medications in like suitcases. We were like, what do we do? Suitcases. We try our own shipping methods, reach out to shipping companies. We tried, many different things, but I think first it started as, where do we start from? And who do we have to reach out to? Who can help? Who has the experience? And this Facebook group really connected us with some people in the DC, Maryland, DMV, DC, Maryland, Virginia area. And these people some of them had really, had some really good experiences in, shipping medications, sending drugs either in suitcases, or at least they knew some of these NGOs that could help. And a lot of them were also doctors. So we expanded our network to students, Georgetown students, George Washington students, doctors in the DMV areas. We also reached out to big tech employees that were eventually able to match our donations. We reached out to US-based NGOs, mainly MAP International, that we will talk about later, and MedWish International. Both of them usually receive tons of medications, medical supplies from as donations from big pharma companies, pharmaceuticals, or from hospitals, and they donate them to countries in need. So basically, we were able to establish this huge network of people, of professionals who eventually were able to collaborate. We put them together, and the outcome was that MAP International, on one hand, was able to collaborate with P2P organization, a US-based Lebanese-led NGO, and on the other hand, this was for medications. For medical supplies, MedWish International collaborated with House of Christmas NGO, also Lebanese-led. And I think this was the part that took the most time for us. We tried to find the right people, the people that we would trust, the people that we thought were the right people for this, who would deliver the medications in all transparency and ensure that none of them are sold or stored. And we heard a lot of stories of hospitals storing medications for financial purposes, given the crisis, or even pharmacies. And so along the way, we had to change, unfortunately, some of our partners, because we discovered some things that were not aligned with our goals. And there was some lack of transparency at some point, but eventually, alhamdulillah, it all worked out, and now the medications are in Lebanon and in good hands.
Excellent. And so basically, it started off with some connections in DC who connected you to other NGOs and other areas outside of the DMV area, which helped you get the donations, right?
Correct. So if in simple words, yes, but it was more of we had to ask so many people, even connect with people in Lebanon who could help, people in the Lebanese army, for example, people who are a guy in a shipping company, an American guy in Pennsylvania who ships a lot of medications to Lebanon. So really, it was a mixture of things, but eventually we focused on, or at least we got the most help from two physicians in DC, and this is how we started.
So Nadia, now, so these physicians helped you, I guess, connect with some of these NGOs, right? So how did the connection start? Because obviously the donations were going to the NGOs, right? And then the NGOs were getting the medications to be shipped to Lebanon, right?
Yes. So I think for MAP International, actually, I had a friend in med school here at Georgetown who did like a similar like mission trip to South America. And I had asked him about it, and he was like, "Oh, you have to check out this company, Map International. They're so great. Like you pay a very small fee, and you get like giant boxes or containers of a lot of donated medications." So we looked into it, William and I, and we really liked the company. And then from just talking to people, other people knew about it as well. And then just talking to more people, we figured out about MedWish. And I had like one of my professors at Cornell who was very into global health. Like she taught one of the seminars for global health. She was Lebanese actually. So I reached out to her, and she also connected us with the NGOs back in Lebanon. And then one of the doctors in the DMV area that we were working with connected us with the other NGO P2P. So it was a very, very joint effort. Like I can't emphasize how big of a group effort this was, and how much teamwork it took. So it was just from talking to different people, and we ended up hearing the same similar things, like MedWish and MAP came up a lot. So we knew that they were the right companies to work with, or organizations to work with.
It was easy, I guess, to connect with them and start the process.
Yeah, I think we emailed them with the doctors that we were working with. There was like a big email chain, and they were very receptive right away, very responsive to all the emails. We actually spoke to them on the phone a few times. And then eventually, once we connected MedWish and MAP with the respective NGOs, they took it from there and they kind of figured out all the logistics together. But we made that initial connection. And those companies were really great to work with. They were very responsive, very receptive, very helpful.
I guess those two doctors that you mentioned were very helpful in this process. So it's up to you guys. Do you wanna mention their names?
Of course. So there's Dr. Jamil Bayram, emergency medicine at Hopkins, and there is Dr. Marie Rose Alam. She's, I think, now the CEO of a big psychiatry hospital in Maryland. Both of them were of extreme help. We worked really, يعني, we really worked a lot. I think day and night even. We had our WhatsApp groups, talked over the phone, did Zoom meetings.
Amazing.
We're trying to find, through our common connections, who the right people would be. And I think they were of huge help in our campaign.
Also, Dr. Josiane Abisab was also very, very helpful. And she was actually friends with Dr. Bayram. So she was my Cornell professor. So it was kind of a joint effort. But we mainly were like on the daily talking to Dr. Alam and Dr. Bayram, who were both amazing.
How did you reach out to get all the donations for this?
Yeah, so we initially started with hosting like a fundraising event here at Georgetown both on the medical campus and the undergraduate campus. And we called it like Medical Drive for Lebanon. And we collaborated with different clubs, like William and I were the leads for the MSF Doctors Without Borders chapter at Georgetown. So we did it through that club. And then the Georgetown Arab Society and the undergrad school also collaborated with us for this campaign. And that day we collected in-person donations. Some people came and actually gave us medications, and those are the ones we sent in suitcases. But the main part of this campaign was the monetary donations. People were just more willing to send a few dollars than go and get medications themselves. And it proved to be much easier in the end to not send things in suitcases. But so we collected those monetary donations via Venmo for the MSF Venmo that we had. And in one day, we actually made around like $6,000, which we didn't expect. It was a great success. And we continued to collect funds by promoting our campaign on social media. So we sent out the flyer, we would post, people would share our posts it was like on Instagram and Facebook mainly. And this also kept the donations coming. And then Dr. Alam and Dr. Bayram actually led another campaign. That was the one for MedWish. And they raised just in a few days from posting on Facebook around $5,500 as well. And those donations went a very, very long way because we were able to match them twice, not just once. So the amount quadrupled. And then that was enough to cover the cost of sending 2 large containers, one with MedWish and one with MAP. So everything in the containers was completely donated from those organizations, but we paid for the fees, the shipping fees, and all the logistical fees using the funds that we raised. So the first container that was sent with MAP actually contained around $2.5 million worth of medications, and the MedWish container contained $165,000 of medical equipment and supplies. So our effort was really like amplified, like so much more than we thought it would be.
Yeah, William, basically you collected how much money, if I don't mind me asking, how much money were able to collect? And it seems like the donations were from everyone, not just Lebanese Americans or Lebanese living in the US. Looks like people from all over were donating to this campaign, right?
Yeah, a lot of people, even in our class who are not Lebanese, a lot of them really donated a lot of money from the undergrad coming school at Georgetown, GW. So many people who are not Lebanese but saw the need in Lebanon really wanted to have donated. Now, as far as how much we collected, so we quadrupled our amount, as Nadia mentioned. So we first doubled it, were able to match it to the big tech company, then doubled it again. But I think it was around, if I'm not mistaken, like 30 something thousand dollars. But this covered the service fees. So each medication we had to ship has its own service fee. And we also had to pay for, as Nadia mentioned, logistical fees and shipping fees. And we also had other NGOs help us with the fees for shipping because at some point they were quite expensive. But basically, this is kind of what Nadia was saying, that we were able to amplify our impact. So $30,000 could have bought, just a few medications, some of them really expensive. So we could have just sent a small, bag of medication or a few 10 bags of medication, for example, with $30,000. But with this money, we found the most efficient way to send the biggest amount of donations to Lebanon. And I think this is what other people should do. If people have a similar idea, can raise money. Some even students reach out to us, me and Nadia, and they were able to also donate, millions of dollars by following the same path or putting these same people that we put together, and eventually we're able to ship these medications to Lebanon.
So basically, you had a great idea of it's not only the money that you collect, it's more the importance of connections and trying to establish a certain pathway that works very well in this situation. And you guys were able to do that. You only had to collect $30,000, not even 30,000 because you probably collected less, but you had matching donations that happened. And so that was important. From that standpoint, but then the $30,000 became millions of dollars by you connecting with different NGOs that work on this process, right?
Exactly, that's exactly it.
How did you connect? So my next question for you guys is, you connected with the NGOs here. How did you connect with the NGOs in Lebanon? And how did you vet them? Because I'm sure it's harder to vet the NGOs over there, because here at least there's websites, what their administrative fees are, where the money is going. How were you able to vet the NGOs in Lebanon and connect with them?
Great question, because that was the biggest barrier that we had. We really wanted to make sure that the donations were going to go to the right place and go to the right hands, because we had heard, like William mentioned earlier, a lot of stories like the government in Lebanon is super corrupt, but some of the people are too, and some of the NGOs are too, unfortunately. So we started by asking around, some of the doctors that we worked with here recommended some NGOs over there. Like one of them was involved with one. And then we started asking more people, and we heard some stories about lack of transparency or prioritizing certain hospitals. So we immediately changed our path. And then we ended up having extensive long meetings with these people and going through exactly what the process was going to be. We wanted to see receipts for everything. We wanted to know constant communication of when things get there, where they are, where they're getting distributed, the exact amount. We have Excel sheets of the exact amount of medications or supplies that went to each place. And we just made sure that they got there and they got to the right places that they said they were going to get to. So I think just a lot of communication, transparency, proof, And just word of mouth, hearing good things about those people was how we vetted those organizations. And having like people in the healthcare system back home helped because they were aware. Like I knew people at LAU who knew that the donations got there and made sure that they were like the right things that they said they were going to send. So we just had a lot of extra volunteers to make sure that everything went very smoothly, which it did. They did an amazing job. But yeah, you're right. You made a good point that this was like a big part of the process for sure.
William, do you want to add anything? You want to add anything to this?
No, I think Nadia covered everything. Maybe I can tell you more about where these medications ended up eventually. So for the medical equipment, Dr. Sirij Meli from House of Christmas did a really amazing job at making this process extremely smooth. And the container that we shipped had around 37,000 items, and they reached the port on March 6th and were released in like April something. The goods were organized, distributed by him and his team in the following just 2 weeks to 8 hospitals all over Lebanon, in the north, in the Ba'a area, in Kisirwain, in the greater Beirut area. And in addition to that, they also sent medications to a lot of PHCs in the country. Now for this is for the supplies and equipment. Now for the medications, the distribution was done by Wasim Kabbara from P2P and his team. And he also worked closely with the Manal Ghassan Saab Foundation. And Manal Saab was really helpful in this whole process, especially in the shipping process of medications. And also Wasim was a very professional worker. He made sure that they were delivered to more than 15 hospitals and health centers, NGOs, even smaller initiatives, healthcare initiatives in the country were able to benefit from our donations. And I think, as we mentioned, we had a lot of antibiotics, cardiac medications, GI medications, but I think the main focus of our campaign was antipsychotics, and the biggest benefactors were these centers, such as Deir Salib, that had a real big focus on mental health. So yeah, I guess eventually we were recognized by the US Ambassador, Dorothy Shee, for our efforts on national TV, and also by Georgetown University at one of our gala dinners. And I guess this is when our campaign ended really recently. It took about a year. But we're so thankful for everyone that made this happen, all of our partners. I think without all of these people on the way, none of this would have been possible.
Exactly. It's a big group effort and not an individual effort. And can you just mention again some of the partners so we can thank them for this huge effort?
Sure. I guess we can start with, I don't want to miss anyone, but MAP International were of great help. MedWish International, great help. I'm not going to name the individuals, but all the employees, and Wasim Kabbara from P2P, Dr. Sirij Meli from House of Christmas. We mentioned Dr. Jamil Bayram. We mentioned Dr. Marie Rose Alam. We mentioned Dr. Josiane Abi Saab. Who am I missing, Nadia?
Dr. Cyril Shimali.
I did mention Cyril, right? Yes. I don't think, am I missing anyone?
No, that's all of them.
Yeah, I think that's all
The
of them.
Manal and Hassan Saab Foundation.
Correct. Mm-hmm.
All of our donors.
All the donors, right? And all the donors
are like the big
Yep. Yes, thanks to both of you. And I think one thing before we end it, I think one thing that's important is we always forget when you talk about healthcare, sometimes you forget mental health, but mental health has been a big deficiency of medications in Lebanon for that, including antipsychotics. And from what I heard from some people, also medications for ADHD and stuff. And some kids have had to wean off their stimulants due to the lack of the availability of stimulants in the country. So that's a very big deficiency, and there's a huge need from that standpoint. So thanks to both of you and to everyone who has helped you with this. This was a huge undertaking, and I think you've already mapped a pathway for others to follow to be able to get large numbers of donations of medications to Lebanon and maybe to other countries too.
Yeah.
Thank you.
Thank you so much. I just want to say, like, if you take something from this, it's that you never know what small idea or small effort, how big it can turn and how it can snowball into like a big life-saving campaign. So if anyone's like wants to help, I really encourage them to do so. It does take time and effort, and energy, but it was a very gratifying experience, and we were so grateful that we were able to do that. And of course, if anyone has questions about this or wants to reach out, because William and I want to keep working on this and turn this into a more sustainable effort, something that can keep going for the long term. So if anyone is interested in ever helping or wants to know more about how we did this, of course, feel free to reach out anytime.
Of course, I think we're both willing to help anyone who's interested. And as you mentioned, the takeaway is that even the simplest move, just a Facebook post, a Facebook message, just start from anywhere. It will go a long way. Just put in the work and effort and motivation, and um, any work can really move mountains.
Yes.
Basically, if you have an idea, uh, go after it, and it'll eventually work out if you work for it.
Yeah, exactly.
All right. Thanks to both of you. Thank you.
Thank you so
Thank you,
much.
Dr. Jean.